clinic and also to reach patient. Okay. So next we'll talk about the impact. So the outcomes, it can range from no effect, which means the medication error actually reached the patient, but no harm was done, to a very detrimental outcome, which means death or disability. Okay, impact can be hospitalization. These patients might need hospitalization, or increased length of stay if the patient is inpatient. Okay, and then disability, birth defects, especially when we use contraindicated medication in pregnant women. Okay, patient disability. Okay, it's a redundant thing. Sorry. So and then death, and also a loss of trust and confidence to our healthcare system, which means the patients will tak percaya dengan doktor, dengan nurses, dengan pharmacists, dengan any of the healthcare professionals. And this will lead to financial implications where the patient or the institution or national organization, they need to pay additional healthcare expenses to actually for the hospitalization, for the monitoring, for the legal fees and settlements. So next it will be the outcome. So how do we categorize outcome? So we can see this coding is actually from the National Medication Error Reporting System. It is by KKM. So A is no error, but actually no error is considered is put here as a category because no error is when there was no error, but it is potentially to cause error, then it will be in category A. Then B, C, D, you can see error is happen. Error happen, and then it for B does not reach patient. It means that patient did not take the medication. Okay, and then C is reach patient, which means the patient already took the medication, but no harm was done. Then D is no harm done, but we require monitoring, or we need some maybe lab investigation to ensure that no harm was done on patient. However, on E, F, G, H, these categories are put under error with harm. Okay, so E and F, those are temporary harm, and then E require intervention, and then F require hospitalization, and G is permanent harm. H and a patient that has permanent harm and require intervention to sustain life, and then I is that. Okay, so how do we say if the medication has reached the patient, but patient didn't take it? Is it a medication error? It is a medication error. As long as the medication, the wrong medication has reached the patient dah pegang ubat tu, it is an error. Okay, unless it is intercepted by pharmacists or by nurses before the administration, before it actually patient dah pegang ubat tu or being administered, it is a near miss lah. So we'll go into the root causes. So it can be simplified into 3 stages for medication error. Prescribing, dispensing, and administration. Okay, so prescribing, by nama dia we all know lah. So it's about ordering medication. In our hospital we use system, but some other hospital they use manual prescription, which means doctor has to write. So eligible writing yang tak boleh baca, and then it cause error. Those are all prescribing error. Okay, then next will be the dispensing error. Dispensing error is mostly happen. It mostly happen in pharmacy lah. So the preparation, preparation is not like dilution, all those things only, but also like we pack the medication, we took all the medication, and then we dispense to the patient or nurses. Okay, those are dispensing error. Then the third one will be administration. Administration is when the medication is being administered to the patient. Okay, so why error happens? Okay, so of course all of us will be asked, if there is a medication error, we all will ask, kenapa error tu jadi? Okay, so first, factor will be man. Okay, man will be something like, okay, attitude. Attitude is a man issue. Okay, not enough staff, insufficient staff is in man. Okay, so insufficient experience, it is man. So and then this man will actually handle the machine. So machine will be label printing, okay, like prescribing in the system. Okay, machine is anything that has relation with the technologies. Okay, and then materials. Okay, materials are the tools. So for example, kalau a compounding machine dia rosak and then it cause error, it is a tools as well. Okay, and then the method is mostly about administrative, which are like the department or hospital policy, the standard of operation, the work instruction. So how do we use these documents to guide our staff to do work? Okay, and also environment. Environment can be based on the hazard lah, noise hazard. Okay, whether the working area is conducive, dia macam sempit sangat ke, then atau dia macam tempat yang letak benda tu is too far ke, macam mana ke. So those are the factors that cause errors. So these are the examples. So using of incorrect abbreviations, these are in the prescribing error. Okay, miscommunication, missing information. These are missing information might be from machine or the machine or materials. Okay, lack of appropriate labeling. So this can be man and it can be machine as well. Working environment, poor management can be in the method. Okay, so causes of errors in hospital can be due to product expired and deteriorated. So just now we have a category of medication error, which is the deteriorated error. Okay, and then we have incorrect duration, dose, preparation, dosage form, strength, rate, timing. So when we administer the incorrect one of these is a medication error. It can cause a medication error. Then if there is a known allergy and contraindication, but we want to serve the medication, it can cause a medication error. And environment, distraction, okay, and patient own action. Okay, so what is patient own action? Sometimes we told patient to take, okay, for example, an inhaler, MDI salbutamol, 1 puff BD, BD twice daily. But patient went to take up to 10 puff 2 hourly. Okay, it's not wrong, but based on direction from the doctor, it is incorrect and it is an error. Okay, so sometimes it's like, okay, all the steps in hospital can be correct, but when it reach patient, the patient, some patient they might macam salah dengar or anything, so this will cause error as well. So patient own action, and this can be settled by a proper counseling lah. So next, I will pass to Sister Najwa to talk about mitigation.
Okay, for the mitigation part, it's more to reduce the medication error or the steps to reduce the medication error. One of the ways to reduce the medication error is that you have to report the medication error. Incidences can be reported through IID1 in SASMED. So this helps us to evaluate the risk and prevent errors. And then the second one is analysis and monitoring. Analysis is very important because once you get the results or outcomes, you can analyze the medication error reports. And from there, you can find the solution or at least take action plan. And this one, to conduct root cause analysis, you need to have a team. Risk reduction strategies. This one in management of medication error, we have risk reduction strategies, whereby there are 5 strategies. Number 1 is elimination. Elimination is more to remove the hazardous or actions that can lead to medication error. And number 2 is substitution, whereby you replace something hazardous equipment with safer equipment, for example. And then the third one is engineering control. whereby you can use IT to help you to ease the process or the flow so that the medication error can be prevented during the journey. And the fourth one is administrative control. This one is more to procedure or SOP and education and CME. We can implement the checklist and safe work practices or improve staff rotation. And that one is included in administrative control. And the fifth one is personal protective equipment, whereby you use the protective equipment to protect the staff. The fourth one is establishing prevention strategies, whereby in that department you create medication safety committees, which aims to avoid financial penalty and avoid lost trust in community. This is very important because when you see there's a lot of medication errors happen at that facility, sometimes the community couldn't trust you, so you have to create the medication safety committees in order to gain trust. And then the third one is to avoid legal actions, of course, and also the final one is to look for root cause. In establishing error preventive strategies, you can also include medication safety elements in the ward checklist or pharmacy visit list or in audit. So during audit, the auditor can actually tell the auditees to tell them the action plan that they have to take. So these preventive strategies can be taken as long as you abide. And then the fourth one is dissemination of information. This one is very self-explanatory, whereby you organize continuous education sessions to share error and preventive strategies by making it unknown. Okay. The fifth one is quality improvement program. You can make it quarterly or half yearly to execute one action plan that can improve the staff workflow in the whole department. This is more to record and analyze all drug selection, preparation, labeling and filling errors identified during routine checking processes. So this one is more to quality lah. Bila you tengok staff prepare or fill, you boleh check kalau ada steps yang boleh dibuang ataupun di-replace. So dari situ you boleh improve the quality. And the final one is to adopt just culture. Yang ni paling penting sekali lah. Bila ada medication error berlaku, kita kalau boleh nak kurangkan critical judgments to the one who make the mistakes and also to the one who report the medication error. Yang ini kita kena adopt no blame culture. Because sometimes things memang happen lah, kan kita dah follow, but things happen. So bila jadi macam ni, number one is to report, and number two is to make sure kita adopt no blame culture. The final one is to enhance cooperation between healthcare providers lah. Yang ini antara doctors, pharmacists, kita nak ada kerjasama lah antara kita. Okay, yang ni kita nak masuk statistics. Medications error reported in 2021, which is last year. In patient pharmacy, a number of ME reported 17, outpatient pharmacy 7, production pharmacy 2, and ward unit clinic is 20, which is making the total to 46. We believe that there are some under-reporting from any of the units, but starting now, we really hope that the wards or units or clinics or even the pharmacy itself, we can adopt the culture to report medication error. And also, we need to adopt the no blame culture after this. Yeah. Medication error prevented. This one is intervention. If you listen to pharmacy staff or pharmacists calling you to intervene or to confirm with you, this is the interventions. Total in 2021, we already intervened the doctors. In total is 2,163. That's a lot of interventions. Inpatient pharmacy is the highest one, 1,410, because we have pharmacists on call, we have PM shift pharmacists who work during the weekend also at night. So we have to intervene the doctor and confirm with the doctor. doctors, you have to be genuinely grateful if the pharmacy staff call you, because sometimes the confirmation is required for the patient's care. Yeah. Okay. The last one is strategies to reduce medication errors. What we should do to reduce the medication errors in our hospital. Okay, number one is to employ an adequate number of staff. This is very important. Lack of staff can lead to medication error, whereby you can cause a brain fatigue or as obvious as physical fatigue. Second one is use a standardized measurement system, whereby you restrict to 1 to 2 strengths of medication kept at the facility. For example, is atorvastatin 20 and 40 mg only kept in the facility. So you can reduce the strength and you can focus on the medication only. And the third one is use error tracking system. For example, you use computerized prescription, which we have right now. Screening, counter checking, whereby we use the barcode to check the medication. And the fourth one is to review original prescription or to read doctor's clear case note. The case note should be written clearly, doctor. The plan, if you want to reduce the dose or increase the dose or even to maintain the treatment, just write a simple thing in the case note, because we as a pharmacy staff, we read your case note. And the fifth one is to compile medication profile. This is more to the pharmacy part lah, whereby you have to understand drug interaction or at least know how to check in the app. Doctors also, it is very helpful if you know the drug interaction as well. The second part for the strategies is to provide suitable work environment. For example, one-way flow. In the pharmacy, we need to have the one-way flow whereby you have to screen and then the medication move to the filling and then counter checking and then to the dispensing. One-way flow is very important if you have the adequate space. Process need tidy, systematic, psychological safe work environment. Psychological safe work environment is more to psychologically lah, whereby your colleagues make you feel safe to work there. And then automation or arrangement of drugs. This one to maintain an accurate inventory. Kalau nak ikut alphabet ke ataupun physiological order ke, up to you. As long as the drugs are arranged accordingly lah, kalau you nak alphabet ke physiology. So automation macam ni senang for the pharmacy staff to fill the medication from the right cabinet. And then create a risk management unit. Yang ini more to inventory, whereby you check the minimum or maximum of a drug. So that yang ni you boleh avoid transfers or loan from other hospital with different brands. So yang ini kena start from purchasing to the inventory. So start from medical store until the end user. Jadi kita boleh kurangkan transfer from other hospital lah if we need the medication. Why? Because you can use your own medication from the brand that you purchase. And then yang ini, doctor writes a clear plain in case note. Dah bagi tahu tadi, sebab pharmacy staff dia screen, dia kena review dulu before proceeding. So kalau ada changes or even maintain the treatment, you have to document it. And the last one, which is the most important one, never verbal, always document. Every plan, every intervention with other healthcare professional, with your doctors, with the specialists, or even intervene dengan siapa-siapa lah, don't forget to jot it down. Ini paling penting sekali lah. So you can save yourself in the future. Okay, for the summary.
Okay, so hello. So I'll be summarizing the whole session, whole sharing session. So first, medication error is preventable. So we must always remember that these errors are avoidable and it can be prevented from reaching patient if we all cooperate properly. Okay, so when you encounter, please report. Okay, and then for the leaders, don't inhibit your subordinates or your staff to actually report any medication error that has occurred, regardless whether they are the one who did or other people who has done the medication error. So we have to adopt a just culture. Just report. What is just culture? Just report. Okay, just report and then we just analyze. So the leaders will analyze and monitor, and then we will be establishing and implementing the strategies, the preventive strategies to prevent the same error from happening again. Why we promote everyone must report a medication error that has occurred? It's not because we want to blame someone. We want to say, oh, okay, this person is wrong. We have to kick him out, kick her out from the institution. No, we want to know what is in the system and what is the failure, and want to cure the failure and to prevent the error to happen again. So you can see what Sister Najwa has shared about the strategies. Those are all targeting the causes of medication error. So we target the cause and then we prevent the error to happen. The number of medication error will drop lah. Okay. So what is the strategy? Start now. We have to start reporting now, and then we start whatever we can do now. Okay. And then find the root causes and execute an action plan by analyzing and monitoring the error reporting lah. Okay, so that's all from us. These are the references that we used. Okay, so thank you. So we may proceed to Q&A session. So is there any question from the floor?
Maybe we can tutup slide ni and then cameras.
Check all the stop sharing.
Alright, so is there any question for Brother Tan Boon Yuan and Sister Najwa? Alright, so if there's no question, thank you to Brother Tan Boon Yuan and Sister Najwa Nodiana from Pharmacy Department for the talk. Hopefully all of us can get benefit from this talk. With that, we end our talk with Tasbih Kifara and Surah Al-Ans. Thank you.